Hello and welcome to December's Wellness Moment on heart health. Today we're going to be talking about heart disease in the United States, what a heart is like under pressure, and what is a heart healthy lifestyle. So what is heart disease? Heart disease is a term that includes several diseases and conditions, including coronary artery disease, arrhythmias, heart attacks, and heart failure. Sometimes heart disease can be silent and have no symptoms, which is why heart disease is known as a silent killer. It's important to know your risk. 1 in every 4 deaths in the United States are attributed to heart disease. 655,000 total deaths. High blood pressure, high cholesterol, and smoking are key risk factors for heart disease. Nearly 50% of Americans have high blood pressure. Heart disease is the #1 killer in both men and women in the United States. So what is blood pressure? Blood pressure is the amount of pressure of blood pushing against the walls of your arteries, which carry the blood to other areas of your body. Arteries carry blood away from the heart, veins carry blood back to the heart. When your blood pressure is too high, it can lead to conditions that cause arteries to weaken or clog. Your blood pressure can change throughout the day, though. Your healthcare provider may be able to diagnose you with high blood pressure or hypertension when readings are consistently above normal. American Heart Association and American College of Cardiology have set blood pressure guidelines. These are in terms of systolic blood pressure, which is that top number, over the diastolic blood pressure, which is the bottom number. Systolic blood pressure is the amount of pressure on the arteries when your heart is contracting. Diastolic blood pressure is the amount of pressure on the arteries when the heart is relaxed, in between beats. It is normal to have a systolic blood pressure less than 120 and a diastolic less than 180. If you have elevated or prehypertension, this is systolic blood pressure of 120 to 129, with the diastolic still being less than 80. Stage 1 hypertension is a systolic blood pressure between 130 to 139 and a diastolic blood pressure between 80 to 89. Stage 2 hypertension is a systolic blood pressure of at least 140 and a diastolic of at least 90. A hypertensive crisis is an emergency, and you should contact your provider right away if your blood pressure is in a hypertensive crisis range. This is a systolic blood pressure over 180 or a diastolic over 120. High blood pressure does not always present symptoms. The only way to know if you have high blood pressure for sure is to make sure you get it checked. Despite the prevalence of high blood pressure can do a lot of damage. It can damage your arteries, leading to heart disease. It can damage your brain, your kidneys, and your eyes. But there are ways that you can manage your blood pressure. Having a heart-healthy lifestyle is important to prevent heart disease. This includes lifestyle choices such as a healthy diet, maintaining a healthy weight, being physically active for at least 150 minutes of moderate level activity per week, not using tobacco, limiting alcohol consumption, and getting enough sleep. The DASH eating plan was developed to help reduce hypertension. It stands for Dietary Approaches to Stop Hypertension. It is a heart-healthy eating style that is flexible and balanced. It includes eating lots of fruits and veggies and whole grains, having fat-free or low-fat dairy products, fish, poultry, nuts, beans, and vegetable oils, limiting foods high in saturated fat, limiting sugar-sweetened beverages and sweets, and lowering your sodium intake, which includes salt. Other ways to manage and prevent hypertension include getting your blood pressure checked on a regular basis, taking your medication as you were prescribed, making healthy lifestyle changes, and also practicing good stress management and sleep habits. And managing your diabetes or prediabetes if you have either diabetes or prediabetes. Most people with diabetes also have high blood pressure, and both can increase your risk for heart disease. You should talk with your healthcare team about how to best manage your conditions. Your provider can also diagnose a heart condition, which is why it's important to have your annual physical. So make an appointment today with your own primary care provider or your Everside Health provider to discuss what you can do to lower your risk for heart disease and high blood pressure. This is our location and hours of operation for the doc. We are open until 7 p.m. on Thursdays. If you have any questions, you can reach out to me at sarah.wiseman@eversidehealth.com. Thank you and have a great day.